Hi, everyone. I'm Dr. Rita Roy, CEO of the National Spine Health Foundation, and I'm the host of the Get Back to It podcast. Here, we share real stories of healing and recovery from people who overcame spine problems and returned to the lives they love. These success stories are powerful, inspiring, and sometimes unbelievable. Let's dive in. At the Get Back to It podcast, our goal is to tell stories of spinal champions who've been able to achieve a better quality of life through spinal healthcare. Today's guest is Silver, a scientist, writer, and chronic pain warrior. Silver's journey began with back pain as a teenager, but it intensified during her years as a PhD student at UCSF. From misdiagnosis to spinal fusion surgery, Silver's path has been anything but simple. Yet, through science, perseverance, and even poetry, she has found healing and purpose. Silver's journey with back pain began years before her diagnosis.
As a teenager, I remember carrying heavy backpacks that started my back pain journey. And over time, it became something that I just have to live with. Doing my PhD at UCSF, and I was spending long hours in the lab on a computer and even doing an FDA fellowship in 2023, it really escalated to a level I could no longer ignore.
At first, the cause of Silver's pain wasn't clear. What were some of the first symptoms you noticed that made you think something more serious was happening?
Initially, I was told to go and change my bed mattress, and my concerns were dismissed despite the chronic low back pain. Then an urgent care doctor diagnosed me with SI joint inflammation, but the pain kept getting worse, even radiating down both of my legs with sciatica. Especially after getting physical therapy based on the wrong diagnosis, everything just flared up. This pain consistently lasted all of the summer of 2023. Finally, my primary care provider was eventually convinced to order my MRI. And it wasn't until the MRI that I finally received the right diagnosis, which was L5-S1 spondylolisthesis due to bilateral pars defect.
That must have been scary and validating. Scary to hear the big word spondylolisthesis, but also validating to finally have an answer. Silver, how did you feel when you finally received the diagnosis?
Yes, I definitely had a lot of anxiety about the news, and I had to do a lot of research on my own to understand what that diagnosis means. I was in shock and extremely nervous about my future, especially being in grad school and beyond. And I did not expect to get such a complicated diagnosis.
After trying conservative care, Silver faced a major decision.
I had a steroid injection in the fall of 2023, but that did not bring lasting relief. And ultimately, I had to make the difficult decision and choice to undergo surgery, especially because of the overall spine instability that could cause future major problems. The surgery was a spinal fusion with a laminectomy in December of 2023, which was meant to stabilize my spine and reduce the disc bulge.
Surgery is a very big step. Before making that decision, what other treatment methods did you try, which might have included medications, alternative therapies, or even lifestyle adjustments?
I was mainly on muscle relaxants and NSAIDs, as well as a short course, 1 week of oral steroids to relieve pain, discomfort, and neuropathy. But I knew I did not want to be on medications for long due to side effects. And I honestly did not want to return to PT after the MRI results because I was worried and scared that things could even get worse.
Going into surgery, it is not uncommon to have fears or expectations of outcomes that might be scary. And can you remember and share with us what some of those vivid memories were?
Yeah, I wrote a poetry piece, a poem about my experience going into surgery. which I would love to share. But to really summarize, it was definitely scary, kind of going to this world of unconsciousness. It was my very first surgery, granted a very major one, with a lot of risks and unknowns, like paralysis, for instance.
Recovery is not always straightforward. Tell us about your recoveries.
I've tried everything, gabapentin, duloxetine, low-dose naltrexone, cyclobenzaprine, physical therapy, another steroid injection, and even ketamine infusion. And some things helped, others flared my symptoms, including PT, which in particular has been both a blessing and a challenge. But slowly, I've regained some normalcy despite the roller coaster ride of recovery. By 2025, I was able to take my first post-surgery trip, took a flight to San Diego, which was less than an hour, and I was able to enjoy the sun, be in a pool again, which felt like a huge victory. And using the airport wheelchair is such a life-saving tool.
Physical therapy can be a turning point, or sometimes another hurdle for many spinal champions. What kinds of physical therapy or exercises have been most helpful for you? And what insight can you share with other people who are starting their rehab journey after surgery?
Any core-related workout really helped me build a stronger back and core, but I also had to learn my limits on how much to do without flaring up my pain, which requires a lot of patience and trial and error. My biggest advice would be to manage expectations and finding joy in small wins and victories.
Silver experienced many setbacks and even with PT, but there were moments where she felt discouraged and other times where she had to find the motivation to push forward.
Yes, one of my first PT sessions after my surgery, I was doing a quadruped plank, and I accidentally did not do it the proper way. I put myself into extension. So I was in additional pain for 2 weeks. I was really scared to go back to my PT, but I had to keep an open mind and go back to work on strengthening my muscles while being extra careful. I had to communicate that to my PT and advocate for myself so that they know my concerns and support me throughout that flare-up and the journey.
Beyond the medical side, Silver found new ways to heal.
My PhD work focused on breast cancer clinical trials, some patient advocacy, and biomarker research. But I also turned to writing, and I started a poetry blog and a page which connected me with others living with chronic pain and back conditions. It became a creative outlet and a way to process what I was going through and to remind others and myself that we're not alone. My debut poetry collection, Growing a Backbone, was actually released last week, and it's a reflection on healing, acceptance, patience, and perseverance.
Wow, Silver, your story is amazing. And as I'm looking at you, as we're recording this podcast, I just see a young, healthy, vibrant, beautiful young woman who you would never know has been through this pain journey. I mean, just congratulations.
Thank you.
You've gotten through this, but it's still a journey, right? It doesn't go away. I know through my own experience having a spondylolisthesis, it's something that we just have to take care of all the time. It's just an ongoing commitment to caring for ourselves. How are you managing now? How do you find that?
And like you said, it's invisible. Like it's very hard to miss, right? Like we're not constantly on a wheelchair. We're not, on a cane, or some people may use that, or a walker. I used that in the beginning, but that's the thing. Like it's invisible and people would not know what's going on. What are you going through and how are you feeling? And I sometimes struggle with that, but it's always good to communicate, especially with loved ones when anything comes up like a flare up, to be there for you. And I think it's a work in progress. It just never healing, like I put in my book, is never a linear process. It's a roller coaster, right? It's up and down. But I think, like I gave the advice with PT, recognizing the small wins and expressing gratitude really helps a lot. Like even emotionally with the pain, because pain is emotional and physical. They come hand in hand.
Oh, yes. I mean, the study of pain and how people perceive pain and manage pain that's a whole, as you know, huge field of study just in that. Chronic low back pain is the number one cause of years lived with disability in the US and on the planet around the globe. So it is not an insignificant problem, and you're not alone. And yet when you get a diagnosis like this, it feels so lonely and isolating. Tell me about how that felt when you finally got your diagnosis.
Definitely surprised. I knew something was wrong, but I did not have an idea like this would be that serious. But it gave me a perspective to practice more self-care and put myself first. I've always put my education first, which I love. I love going to school. Obviously, I was doing my PhD for 5 years, but I think I learned to prioritize my health and resting when I need to and listen to my body. And that's also a work in progress. I mean, I say this to people and I say this to myself, and really being patient, which is something very difficult that I say this to myself and others too. It requires a lot of patience.
Yeah. However, why do you think it took so long for you to get your diagnosis? This pain started creeping up on you, in high school, really. And, kind of lingered there through college, and it just seems like it just got worse and worse for you. Why do you think it took so long? Do you feel that people didn't recognize your pain, or you didn't recognize your pain yourself?
Right. At first, I was the one dismissing my own pain. I was just saying, oh, I'm just tired. I had so many exams. I'll just put some heat pad, take a Tylenol, and I'll be fine after the finals. And things calm down, but then the next time I have a lot of schoolwork, it will flare up again. And I've always said, oh, my back hurts. But I thought, oh, a lot of people struggle with back pain, so it's just whatever. But then that year, when I was doing a fellowship with the FDA online and working long hours in the lab, working on my thesis, it was a lot happening. And I think my body just had enough of ignoring. But then I was still ignored in the clinic because, a lot of people also struggle with back pain. And the first thing people tell you, just go home, take some ibuprofen, rest, change your mattress, like they told me first, which was very dismissive. But I learned advocacy. Definitely this experience for the past 2 years taught me how to advocate for myself in the healthcare system in America, because self-advocacy is very, very key. Like you have to stand up for yourself. Say, no, this is not going to work for me. I want imaging. Like I really have to push back a lot and get those orders in because I want to know what's going on.
Yeah, I think that's really the heart of our mission here at the Spinal Foundation, is to encourage people to be their own best self-advocate. You have to. And yet so many people are not given permission to do that. And so we're here to say, we are giving you permission. We are here to give you tools. We're here to connect you with people who've gone through a similar experience, learn, get educated, ask the right questions, and don't give up. Can't give up on yourself.
Exactly.
That's what I love about your story, is you just didn't give up on yourself. And that's just hard to do.
Yeah, I happen to have family members who say I'm very persistent. If I want something, I'm going to get it and I will get it done. And with healthcare, that's definitely key. You cannot just ignore your body. You have to listen to it. Yeah.
Well, and it sounds like it took you a while to get there, because you did sort of, and I think, having been a person that lived with back pain for a long time, and I no longer live with back pain, but I do take care of myself all the time. I will say that I used to think, well, doesn't everybody have back pain? Isn't that just
exactly?
Part,
exactly.
It's part of, like, you get older, it's normal to have. And And so, we're very passionate about, messaging. Look, aging is inevitable. Pain doesn't have to be, and so if there is a pain message, it is telling you something, right? Something about your body. Your body is sending you a signal, and don't ignore the signal. And I think one of the other challenges in spine care is that sometimes if you wait too long, there are fewer options that you have for treatment. And that's true in any other disease state in your body. If you wait too long, you ignore the symptoms, your treatment choices narrow. And
That's right.
Something that you don't know until you experience it. And so we want to tell people loud and clear and, shout it from the mountaintops that don't ignore your symptoms, get help. It might take a while to find the right help, but don't give up. Help is out there.
Agreed.
Well, something that has happened, the physical therapy part of your story, Silver, is really interesting. And there have been some big changes in access to physical therapy in the U.S. Many states, and I don't know if it's every state now, but do no longer require you to have a doctor's prescription to go to physical therapy. Tell me what you learned about physical therapy. Was that the case for you? And what was that journey like for you?
I think with physical therapy, it was a little bit challenging in the beginning because I had no idea how to go about it. I've never had physical therapy done. I was told by many people you should do physical therapy. It helps with back problems. The mistake I made was that I went in to my first PT without the proper imaging to guide them through what to do for me.
Yeah.
So, and that's a big lesson. Also to make sure that I or you or anybody who's listening to have the right diagnosis and imaging in your hand before you go without even a doctor note. Really what matters is what is the diagnosis, what's happening. Is it an inflammation? Is it a stress fracture? Is it a disc bulge? That helps a lot. And I learned a lot from that mistake for sure. And beyond that, really listening to those who are around me. I had mentors who also had back surgeries and back problems. And with their recommendations, I went to several people based on their experiences that have worked for them very well. So I consulted with multiple PTs, and I recently started at a new PT place with kind of massage therapy, and it really involves a lot of body works and kind of Chinese medicine, which takes a different approach to even neurological problems and nerve pain. So it's work in progress and kind of being open and noticing there are any red flags from the get-go. If you don't feel comfortable, speak up and say, I don't want to do this. This will cause me a lot of pain, because nobody knows your body more than you do, right? So definitely having an open mind is something I learned, and going in with the right diagnosis, with the right imaging tool.
Yeah, that is such powerful insight to share, Silver. And so much of what we say in the Spine Foundation is that you've got to get the right diagnosis in order to get on the right treatment journey.
Exactly.
And that sounds so basic and simple. But the challenge in spine is that your spine is very complex. You have bones, you have discs, you have soft tissue, you have muscles, ligaments that all attach on and support it. And it's literally the backbone of your body. And so it's not always easy to figure out what the pain generator is. And so that part alone, just the diagnosis journey, can take time. Oftentimes you can find the answer right away, but much of the time it is confusing. And so a lot of the doctors will say, you cannot make a diagnosis just off an X-ray or an MRI. An imaging.
Right.
You've got to take the history, you've got to do a physical exam, and you've got to put all those puzzle pieces together to make sure you've got the right diagnosis. Because a lot of times it's just not clear. There's a study that a lot of people quote that says, if you just pull random people off the street and took an X-ray of their back, 80% of the time they'd have some degenerative changes in their spine. But they don't know that. They're not symptomatic.
No symptoms.
And it's not, and it's not causing a problem. So it's not a problem until it becomes a problem.
Exactly.
So the x-rays can sometimes, or the MRIs can sometimes be misleading. Sometimes there are things there that are not a problem. Other times, it's clear. And a lot of times there's nothing that we can see, but yet we have these symptoms. So it's such an important point you've made. Getting the right diagnosis. Get on that treatment journey.
Exactly.
I love how you said that you have to be open to different, even within physical therapy, different approaches to physical therapy. There's lots of innovation happening in physical therapy. Everything from laser treatments to blood flow restriction, dry needling. Like there's a whole universe of things in there. What was that hard for you to navigate? I know you said you've talked with other people.
Yes.
You feel like that was your best resource to find what to do there?
Talking to definitely trusted resources, but also doing my own research and reading and using kind of different articles to understand what has worked for people. And because back pain is also very complicated, like you said, with individuals having different diagnoses. And just like PT, some, motion exercise might work for one person, but the other would not work for another person. So a lot of research and asking a lot of questions. If I do this, how would you think this would flare me up? How much should I do of this? And you just have to try for me, like I said earlier, trial and error was a big thing to accept, that I might have to try this and it may not work. It might flare me up, but I might get very discouraged for a week or two, maybe longer, but then I have to get up again and try for the sake of building that strength and better mobility. Because, I'm 29 and people my age, they're doing a lot of different things that I might not be able to do right now, but I want to continue to get there. Like that flight to San Diego was a major milestone beyond spine surgery. So I would like to keep taking those big steps and make those milestones happen. And that wouldn't happen if I'm just laying down on a couch, right?
For sure. Silver, we've talked a lot about physical therapy and navigating that. I want to talk a little bit about your surgical experience. Did you identify a surgeon? What were some of those moments like? How did you get information? Share a little bit of that story.
Yeah, definitely. I had a first opinion, second opinion, and a third opinion.
Bravo.
All in the span of 4 months. I don't know how I did that, but I scheduled them like that. Boom, boom, boom. Like I have to get it done. And I had a lot of encouragement around me from family members telling me you need to talk to other physicians and surgeons to see what they think. And because I'm a student at UCSF, I was a student at UCSF, it was readily available for me to look into that institute. And my second and third opinions were people also in the Bay Area, neurosurgeons, and everyone kind of agreed on the same treatment goal and the same surgery, which was honestly, I was very grateful for that nobody had conflicting opinions.
Yeah, that's great.
And the one concerning item that came up between kind of a common thread between all three surgeons was the instability, the pars defect. That something was of a concern for them because of my age, and they wanted to make sure to fuse that part to make sure I don't have additional problems in the future. Even though sometimes my symptoms came very, really slow, not that intense, and sometimes came back more intense, and that was just fluctuating. But the goal was to stabilize that spine. And I think that's something I just had to get done. It was a matter of when, pretty much. Should I get it done while I'm in grad school, or should I get it done, after I get a full-time job?
Yeah.
And honestly, with healthcare and insurance, which is a big topic in America, I thought this is the best plan I can ever have right now, being a student. So let me take advantage of it.
Yeah, that's great. And UCSF, I don't know, did you end up having your surgery at UCSF?
Yes, I did.
Yeah. I mean, it is just a storied, very, reputable, amazing institution. And in fact, we work with a number of the surgeons there, both ortho and neuro, and you're in amazing hands there. So that's lucky you to get to choose a surgeon at that amazing institution.
Definitely.
And so then, you saw these 3 different surgeons. Everybody said the same thing. So that was very validating. You're so lucky that was clear. Then how did you decide which one to choose? Did it come down to like a personality match, or was it just a feeling that you had that, how did you, or was it just an insurance thing? Like this one was on the insurance and that's the one I went with.
It was a combination. Insurance was definitely one item that I had to take in mind. I was a student, wasn't making much money. I needed to make sure that I can afford this surgery. So that was one big item. The second item was talking to them and understanding what their goals were and the procedure itself. How advanced is it? How confident they are. And some of these surgeons have done this for years, and they're using robotics, minimally invasive ways to go about the surgery. And I went with the kind of team that was offering something that's more minimally invasive and hopefully minimizing the pain beyond the surgery.
Yeah, that's great. Amazing. Congratulations.
Thank
you. But you clearly did your research and you did your homework, and maybe it helps that you're in healthcare to really understand how to even read that information. What did you find was the most helpful sources? I mean, I don't know if we were a source for you on that journey. Tell me what that was like to find sources for information.
I think one thing I want to say is I should have done more. I'm always that person that I should have read more. I should have kind of read more about patient experience rather than from a physician standpoint. I read a lot about kind of a physician standpoint towards spinal surgery and fusion. If I had read more on social media kind of posts on patient experience, I would have probably hesitated more, which I think in a way that I'm kind of glad that I did not do that before the surgery, because like I said, it's something that I had to do regardless because of the major overall instability that needed to be fixed. So beyond the surgery, I started reading more about people's experience, and it's a variety of experiences. And depends on, where did you get the surgery? Who's your neurosurgeon? What way was the surgery done? How did you, manage symptoms after and beyond? So I think I would have loved to read a little bit more on resources like support systems. I didn't find that out until later, actually, like after I continued to struggle with pain beyond the surgery. That's when I started looking into resources like National Spine Foundation and National Spine Health Foundation and Chronic Pain Foundation, and also some of the chronic illness communities online too. Maybe if I had done that before, it would have equipped me with more information and kind of manage my expectations better. But I think I did my best at that time.
Yeah, no, you did more than what most people do. And here's the other thing. When you are doing your research, you are also in pain. And it is so hard to get through your day-to-day, deal with the pain, and now you've got to make these big medical decisions for yourself. It's a lot. It's true. Hard. And it's exhausting, and it takes time. And, we just want to be a resource here for people because we know what that journey is like. And I'm really glad you found us on your journey. And I hope that our resources were helpful to you.
They are, definitely. And like you said, researching treatments and making a major decision and advocating for yourself as a patient, it's a full-time job on top of, what you're doing day to day, plus the pain.
Plus the
pain can get overwhelming. Yeah.
Plus you don't feel good. That's the bottom line. We say that the problem that we are trying to solve here at the foundation is that information is scattered and confusing. False claims are commonplace, and bad news sells headlines. And so we want to be that trusted, truthful, unbiased resource to come alongside and to advocate and to share information and guidance as people are going through their journey.
Absolutely. And I love the stories of everyone you interviewed before on the podcast. And those were definitely inspiring to see and encouraged me to reach out and do the same, and learned a lot from them too. So it's a great resource. I'm really grateful that you guys have this program.
Thank you for saying that. I'm going to use that in an ad.
Please feel free.
I guess just one last thing I wanted to just talk about before we wrap up here. I want to hear about your writing and your poetry. I want to know more about your book. We'd love to talk about your book. Tell us a little bit about that as part of your healing journey. Yeah.
Yes. So by almost March of 2024, so three months after my surgery, my fiance at that time, now husband, he encouraged me to open a blog, start an account, because he knows I'm really into writing, and why not share what I've been writing about and kind of connect with people. So I did that, and the page just started attracting so many people. I got a lot of followers in a short amount of time.
Wow.
And I got to connect with so many people from chronic illness, back problem issues, back surgeries, and kind of we shared information, and they would tell me, oh, I did this, why don't you try that? And there were people from all over the place, like India, Europe, Asia, like all over the place, which was very interesting to discuss these things with, because our healthcare in the US is also different. Sometimes it's even more advanced. So when I tell them about a treatment, they say, oh, we don't really have that available to us. And that makes me feel sad, but at the same time, grateful for what we have here too.
Right. Yeah.
And then I kept sharing and built a really comfortable community, very supportive individuals. And I just felt heard. Like you said, pain and back issues, they can be very isolating. Talking to these individuals online felt comforting. Like I'm not alone and they're not alone.
Yeah, and they get it. They understand.
And they get it. Exactly. Yeah. They get what it means.
Yeah. And
then I decided to kind of put it in a book. Because why not? At that point, I kind of collected a good amount of prose and poems, and I started the publishing process in August, released it just last week. And it's been really nice to hear feedback from people. It's called Growing a Backbone. And I give credit to my therapist because she inspired me with the name. I was going with Silver Lining because that's my page name, the Silver Lining. But then I thought, you know what, Growing a Backbone is also it can resonate with a lot of people, and also it talks a lot about strength and resilience at the same time.
I think I just got the title of this podcast. Silver Lining, Growing a Backbone.
Yes. I love that. Yeah. And a lot of it also was inspired by patient advocates I used to work with at UCSF in the breast cancer space. They put together a poetry book about their experience and their healing journey going through breast cancer. So I learned a lot from them, and I appreciate them for also being there for me. They gave me a lot of advice because, as you know, a lot of cancer patients deal with back pain and neuropathy as side effects also.
Yeah.
And so, that's a little bit about my book, and it's on Amazon if anyone is interested to grab it.
Hey, thank you. Yeah, I'm definitely going to check that out. Great. Do you think you'll continue writing? Will you?
Yes. Yeah. Yes, absolutely. This page will keep growing, hopefully, and I keep hoping that it will be a place of comfort for others and for me. And it's a place that I can go to when I feel less encouraged, discouraged, and on my own. It's a place to go to feel comfortable and heard and seen.
Yeah. And that's what we want to be at the foundation. We want to be in this community inclusive. We want people to feel heard, to be seen, and to make connection. And to the extent that we can be a conduit for that, that's our mission. So thank you for being part of our mission.
Thank you.
And sharing your story. Oh my God, it's amazing. I'm so honored to meet you today and to have your time and to help share the good news of what we're doing here and being part of that. Thank you.
Thank you so much. It's my pleasure. And it's such a good experience meeting you and also learning about you and hearing your perspective. And I hope this episode will reach so many people and their hearts, not just them.
Yes. Thank you. All right. That was wonderful. I feel like we've covered everything. Is there anything you want to say in closing that we haven't talked about? There was this prompt here about managing pain, balancing career and self-care. And I feel like we've covered that. If there's anything you want to say.
I could share a piece really quickly from my book, maybe?
Yeah, let's do that. That would be wonderful.
So I wrote this September 25, 2024, so almost a year ago, and I was still kind of experimenting with different treatments. So it says, every day I wake up to the sound and sight of an inevitable thunderstorm of grief. I look into my toolbox of therapy, radical acceptance, gratitude, and patience. I close the toolbox and look out the window. I weather this storm because it left me no other option. I convince myself that this thunderstorm will pass and the sun will shine again someday, somehow.
That's beautiful.
Thank you.
Really, really beautiful. What a powerful metaphor for getting through that. Storm is rough to get through it.
You have to. There's no other option.
No other option. There's no.
Exactly.
It's awesome. Thank you for sharing that.
Thank you. Thank you for giving me the space to share.
Silver, how did you find out about our podcast?
I kept looking for resources, which I love the website. It has so much valuable information for me to continue exploring with this, treatment journey, dealing with back issues. And the stories were very inspiring to me with the Spinal Champions and the podcast. I listened to almost all of the episodes, gave me a lot of perspective, learned a huge amount of lessons from each. And I was just looking into, I'm pretty sure the US has some national foundation for spine, just like how we have, American Association of Cancer Research. I'm pretty sure we have something for spine health, and I find you guys.
Oh, that's awesome. I'm so glad you found us.
Me too.
Sharing that. Silver, thank you for sharing your story of persistence, vulnerability, and creativity. From your work in science to your poetry collection, Growing a Backbone, your story shows us that healing is not only physical, it's emotional and creative as well. At the National Spine Health Foundation, something we believe in most is providing hope for recovery through sharing stories of success and expertise. It isn't always easy to find someone to relate to, even though 100 million adults suffer from neck or back pain each year. To hear more stories of spinal champion recovery and access educational materials about spine health, visit us at spinehealth.org. If you're interested in supporting our show financially, you can contribute at the link provided. Thank you for listening.